If you've ever had back pain so bad you'd do just about anything for relief, then you've definitely heard about steroid shots. They are one of the most common treatments out there. So today, we're digging into a major clinical review to answer the one question that really matters.
Right? If you or someone you know has dealt with that kind of debilitating back pain, the idea of a single shot can sound like an absolute miracle. It's often talked about as this powerful solution to get you back on your feet. But what does the science actually say? Is this thing really fixing the problem, or is it just kicking the can down the road?
To really get why this is even a debate, we first have to wrap our heads around just how massive this problem is. We're not talking about a minor ache here. This is a condition that can completely derail people's lives.
And yeah, this is no small thing. We are talking about a global health problem that hits millions of people, causing constant pain and disability. It's actually one of the biggest reasons people miss work and just can't enjoy their day-to-day lives.
So when you're faced with that kind of chronic pain, one of the first things that often comes up is the lumbar epidural steroid injection, or LESI for short. It has become a go-to option for doctors trying to give patients relief and hopefully help them avoid major surgery.
So what's this shot actually doing inside your body? How does it really fight the pain? Let's break down the science.
Okay, the key to this whole procedure is a very specific spot in your spine called the epidural space. Just picture the area right around your spinal cord and all those super sensitive nerve roots that branch out from it. That's ground zero. That is the target.
The process itself is pretty direct. These powerful anti-inflammatory drugs, called corticosteroids, are injected right into that space. Now think of them like a highly specialized firefighting crew. Their one and only job is to rush in, knock down all the swelling, and calm down those irritated nerves. By putting out that fire of inflammation, they take the pressure off, which quiets down those pain signals being sent to your brain.
And if we zoom in, the science here is actually pretty fascinating. The clinical review explains that the steroids go after these specific chemical messengers in your body, the ones that are basically screaming inflammation. By shutting down these little alarm bells, the injection breaks that whole vicious cycle of swelling and pain right at the molecular level.
But here's where it gets a little more complex. Turns out not all steroid shots are the same, not by a long shot. The technique, the specific path the needle takes to get to that spot, is absolutely critical.
There are three main ways to do this, and each one has a different game plan. The transformational approach, think of that like a sniper rifle. It's super precise, targeting a single nerve root, which is perfect for pain down one side. The interlaminar is more like a sprinkler, covering a wider, more central area for pain that's more spread out. And finally, the caudal approach. That's the gentlest, least precise path, and it's often used for folks who've already had back surgery. So the big takeaway here is this. The type of injection has to be perfectly matched to the cause of your pain.
Okay, so we know how they work, and we know there are different types. But let's get to the million-dollar question. Do they actually provide relief? Well, when it comes to the short term, the evidence is pretty darn compelling. Just look at this number. According to one of the major studies in the review, a full 70% of patients who got a steroid injection felt significant pain relief in the short term. That is a huge result.
And this chart shows just how dramatic that relief can be. Data from another study shows that on a 10-point pain scale, the average score just plummeted from a 6.8 times before the shot all the way down to a 3.4 after. A drop like that isn't just some number on a chart. For someone in chronic pain, that's absolutely life-changing.
But that's the short term. What happens after a few weeks or months go by? Well, this is where that simple success story starts to get a whole lot more complicated.
And here we get to the heart of the issue. For the first 3 months or so, the evidence for relief is strong. It's consistent. But when you look at studies that track patients past the 6-month mark, the results get murky. That awesome pain reduction often starts to fade away.
And this number tells a huge part of that long-term story. That same study that found 70% of people got relief, it also found that 59% of them ended up needing another injection to try and keep that relief going. That strongly suggests that for a lot of people, one shot just isn't a permanent fix.
And of course, we have to talk about the risks. Now, these shots are generally safe, but they're not zero risk. The review points out some rare but possible complications, like infection or nerve damage. It also mentions things like headaches from a dural puncture. That's if the needle accidentally nicks the spinal fluid sac. And even a potential risk of bone thinning if you get repeated injections over time. These are all really important things to weigh in the balance.
So after all that, when you weigh the powerful short-term benefits against the questionable long-term results and those potential risks, what is the final verdict on these things?
And here it is, the big takeaway from the review. These injections are best understood as a bridge therapy. They don't cure the underlying mechanical issue in your spine. What they do is provide a powerful, temporary window of pain relief.
This slide really lays it all out, doesn't it? The pros are crystal clear. You get fast, significant short-term relief that might help you put off or even avoid surgery. And the whole point of that relief is to create a bridge, a period where your pain is low enough that you can actually do physical therapy and other exercises to build a stronger back. But the cons are just as clear. It is not a permanent cure, the benefits usually fade, and there are some risks involved.
And that brings us to the final question, which is really a personal one. The evidence is pretty clear that the shot itself probably won't cure you, but it can give you a crucial window of opportunity. So the real question becomes, is that temporary relief worth it if it lets you get your life back and, most importantly, start the hard work of rehab that could lead to lasting improvement? That's the trade-off at the very heart of this entire discussion.